Welcome back to my channel, or if you're here for the first time, welcome. I'm Stacy. I'm a therapist in private practice in the Jackson, Mississippi area, and this is Ask a Therapist. So every Friday, I bring you a new video where I answer questions submitted by viewers like you on topics about mental health. Elijah asks, if some therapists do not diagnose clients, how do they know which model of therapy to use when helping the client? Also, how can a mental health professional spend so much time around someone and not diagnose them? Okay, so I'm going to answer the first part of that first. If some therapists don't diagnose clients, how do they know what model of therapy to use? There's all different types of therapy, but the vast majority of people practice cognitive behavioral therapy and don't really stray from that. So they're not changing up their approach necessarily based on the client and what they need. And that sounds bad. I can't think of a way to say it that isn't bad. And I think that there's people who are passive and there's people who are active. A lot of people are getting trained in trauma-informed cognitive behavioral therapy or different ways to treat trauma, because we are learning more and more in the field that a lot of the stuff that people are going through is related to past trauma. And that's a great thing, but at the same time, you don't want to be like a jack of all trades, a master of none. So I would definitely question any professional who says that they specialize in like 5 different types of therapy. Just like anything else, there are people who are at the top of their field who do as much continuing education as they can, who learn everything, who practice multiple different forms of therapy. And then there are people who are like in the middle. And I'm not talking about the therapists who, violate laws and ethics and that kind of stuff, but just those middle of the road people who are just kind of coasting. They get done with school, they do continuing education as required to renew their license every 2 years, typically is what it is. They don't really care. They go to conferences. They don't really pay attention. They're not interested in learning. They get their continuing education credits so they can send those in and renew their license, and they're very stagnant. And those people, no shade, not to say that they don't help people. You're not going to get a lot of varied types of therapy from one therapist. I would, as a person looking for therapy, try to find somebody who specializes in what I need. Now, you don't always know what you're going through, but finding somebody that says on Psychology Today or their website that they specialize in what you're going through is going to be super helpful for you in that respect. So I would not go into it whether you're seeing somebody that's like the top tier therapist or counselor in the area. They're definitely going to have a niche. They're going to have a specialty. Or you're seeing just that mid-level practitioner. Regardless, you shouldn't expect them to be experts in every type of therapy and sort of like scroll through and be like, you have this diagnosis, I'll do this therapy with you. Another reason that people don't like diagnosing is not everybody is qualified to diagnose. Not everybody feels qualified to diagnose. Like in a hospital setting, the psychiatrist diagnosed the clients or patients, and the therapist didn't really have much say in that. Insurance companies, if you're going to a therapist that bills insurance and you have insurance, the insurance company requires you to have a diagnosis. So you will have a diagnosis if you're using insurance. Typically, people pick a very vague, I want to say, maybe, diagnosis, adjustment disorder, because nobody likes to label people. There's still so much stigma about mental illness, even in the mental health community. So people are really afraid, like, I don't want to diagnose this person with this because they'll be saddled with that for the rest of their lives, which that's a form of internalized stigma, in my opinion, because, like, no medical doctors are going around and saying, oh, I don't want to diagnose this person with cancer because that'll follow them around the rest of their lives, So it's really in my opinion, this is just my opinion, in my opinion, that is a lack of confidence and a lack of skills on the part of a therapist. You deserve to know what your diagnosis is. You deserve to have a diagnosis, and you can absolutely change therapists or counselors if you feel like this person is not meeting your needs. So the second part of the question is, how can a mental health professional spend so much time around someone and not diagnose them? So much time, really? You feel like 45 minutes once a week where you say what's going on is enough to diagnose you? Yes and no. If the person is doing what they should be doing, for example, when I have an intake, I had one yesterday, and the person was like, I have anxiety. So obviously we live in a world where you Google, you read about it on Wikipedia, you read about it on WebMD. So I said, okay, well, explain to me what you mean by anxiety. How does that feel for you? What kind of thoughts do you have? What kind of feelings do you have? And then as we talked, I asked other questions like, do you ever have times when you feel like you don't feel like getting out of bed? So many loud cars driving by today. Do you ever have times when you don't feel like getting out of bed, or you feel like you need more sleep or less sleep? You start to lose interest in hanging out with your friends. So I'm asking some questions in layperson's terms to describe depression. If somebody comes to me and says I have depression, then I ask questions, later on in the conversation, like, do you ever have times when you feel like you need less sleep? You get really, really productive. You just feel very inspired to write a book or paint a painting. And, that is screening for mania. Now, it's not the same as testing, but the answers to those questions can give you a better idea of what's going on with somebody. With personality disorders, for example, I find that it's very difficult to diagnose them in an outpatient setting. And the reason for that is that the person that is coming to see you is telling you about what's going on in their lives from their perspective. They're deciding what to share with you and what not to say, and you're not getting anybody else's perspective on the situation. Typically, it's people who are in this person's life that pick up on those narcissistic, borderline, histrionic, antisocial traits. So personality disorders are very difficult to spot in an outpatient clinical setting because, you're getting one piece of the puzzle. You're not seeing the whole picture. And sometimes as things go on, based on the things that people say and do, you can pick up on those things, especially if it's something where their interpersonal relationships are very effective, so histrionic or borderline personality disorder. But somebody with NPD could go see a therapist and never be diagnosed. So I think that most of the time in an outpatient setting, the people that are coming in have trauma, depression, anxiety. Those are the main things that I see. Grief as well, but a lot of times depression, anxiety, trauma, grief. And yes, a trained professional can spot what's going on. I mean, they should be able to do it in a couple of appointments, and if they can't, they should be referring for testing. Now, in some cases, there may be a reason that a professional thinks that it is not good for the client to know their diagnosis. If there's somebody who is early on in treatment for something like borderline personality disorder, or people are kind of scared of obsessive compulsive disorder, somebody might be scared of a post-traumatic stress disorder diagnosis, it might be better in the beginning to work with them and get them more comfortable before you tell them that, I think you might have PTSD, or work with somebody on those emotional regulation skills and distress tolerance before you tell them that you believe that they have borderline personality disorder. But ultimately, everybody is entitled to know their diagnosis, and unless you are paying out of pocket, not using insurance, and going to see a therapist, you have a diagnosis. If they don't think that that's your diagnosis, then technically they're committing insurance fraud, so they should be diagnosing you with something that you meet the criteria for, that they think that you have. So it sounds like maybe you're not seeing the right therapist. Yeah, that's what I would say in that situation. If you want a diagnosis and you feel like it would be helpful to you, and your therapist refuses to tell you or give you one, then that's not the right therapist for you. I hope that you have enjoyed this episode of Ask a Therapist. If you're interested in submitting a question, you can send me an email, AskStacey@StaceyAldridgeLCSW.com. You can also visit my website, StaceyAldridgeLCSW.com, to read my blog, learn more about me, or if you happen to be in the Jackson, Mississippi area, you can also get information there on getting an appointment. If you've made it this far, I really hope that you will give this video a thumbs up and subscribe. Also, leave a comment. Tell me what you think about it. All of those things help my channel grow, help YouTube know that this video is something that they would like to share with other people. So it would really mean a lot to me and my channel if you would subscribe if you haven't already. And don't forget, be kind to yourself and be kind to other people too. I will see you next week.